This is Daniel Lee. I'm an orthopedic physician at Foothills Orthopaedics. We have two locations, one in Powdersville and one in Pickens. We're doing this video so we can inform you about your upcoming procedure of total knee arthroplasty. And I want to take a moment to thank you for your trust you've placed in us for this procedure. I hope we never take that for granted, because I know this is a special honor that you will trust us with your health, and I want to assure you that we'll be there for you every step of the way. There's no question that's too silly or dumb to ask us, because it's about your health. We'll be happy and cheerfully answer them. The actual procedure, which I want to talk about now, is sort of gruesome sounding. You can actually see videos on YouTube about this, and I would encourage you, if you feel like it, to look at them. They're actual real procedures by many different doctors that actually go through the procedure in detail. I'd like to show you this on a model today, because I think there's some misconceptions that people think we actually cut the leg off above and below the knee joint and take everything out. We actually do less. It's still a major procedure, but we actually make an incision on the front of your knee from above your kneecap down below your kneecap. We cut through the skin and the soft tissue underneath into what's called the capsule of the knee joint. We then turn the kneecap to the side, and then we make cuts on the bone. We make 5 cuts on the end of the femur bone, and then we glue on this piece. Now, we've carefully measured this before the surgery and during the surgery with special calipers and measuring devices. We mix glue, and then we glue this in place. We come down to the lower leg bone called the tibia bone, if I can get it to go, and we actually cut the top part of that off, and then we prepare the surface, and then we measure it again. We put glue in there with a special glue gun, and we put this piece down. The piece of plastic is separate, and we have different thicknesses and sizes that allow us to make it all fit together. Then once it's all glued in, the glue is hardened, which takes about 15 minutes, we put it all back together. So now the knee moves as a normal knee. And then we go to the kneecap, and we actually saw the undersurface of the kneecap and glue what we call a button on. And that's measured to match the size of your original kneecap. Then we put it all back together and sew up where we've cut through the tendons on the side. We wash it out very carefully beforehand, and then we close the skin. It's a very big procedure, and sometimes I think we take it too lightly because so many are done, but we treat every person as an individual, and we hope that you'll do very well. Here's the part where I talk about the bad stuff that can happen, what we call complications. The most common complication that occur with a knee replacement is infection. And the most common organism or bacteria that can get into a knee replacement is the MRSA, or the methicillin-resistant staph. It's everywhere. It's a very common bug, and if it gets in your knee joint, most likely we'll have to take all these pieces out. We'll put a temporary spacer in your knee that has antibiotics in it. Then you'll get IV antibiotics at the same time. When the infection is all cleared out, we'll come in and take the spacer and put another knee replacement. So if you think about it, now you've had the first one put in, you've had a second operation to take it out, and a third operation to put a new knee replacement in place. So you've had 3 surgeries. So it's a very big deal and a big ordeal. If that happens to you, we will be there all the way for you. In the United States, there's about a 1% incidence of infections. At both hospitals that we operate at, it's much lower, however. We do give you antibiotics before, during, and after the procedure to prevent this, and everyone on the operative team uses a spacesuit and uses strict sterile technique. But unfortunately, they do still happen. The other issue that can happen are blood clots. And any person who has surgery can get a blood clot, whether it's a tonsillectomy, whether it's a hernia, or a knee replacement. We do give you blood thinners very soon after the procedure and ask that you take them for 30 days after the procedure. This will comprise 2 baby aspirin, one in the morning and one in the evening. If you've had a history of blood clots, we may give you stronger blood thinner, and we'd like you to make sure you let us know if you have a history of blood clots in yourself or in your family. The other issue is people ask very often is, how long will this knee replacement last? The weak link in the whole thing is this piece of plastic. The metal doesn't wear out on either side, but the plastic does. On average, knee replacements last 20 to 22 years in people of normal size and normal activity level. Of course, if you're very active or you weigh a lot, it may not last as long. The other issue that can occur is stiffness. Now, some people just have a difficult time because it is a big procedure that is painful, and if they don't move their knee very much after the surgery, it can become stiff, which may require us to manipulate the knee or to really get very aggressive with physical therapy. One of the other issues that people worry about is pain, and we will give you pain medicine. during the hospitalization that is very strong, and then pills when you go home. There's no pain medicine that's going to get rid of all of your pain, however. Now, during your hospital course, I do most of my replacements on Mondays. So you'll come in early that morning. You can't eat or drink anything after midnight. So they want you what we call nothing by mouth, or NPO. You'll meet the anesthesia staff. You'll see me again. I'll sign your knee, answer any questions you have, and the anesthesia staff will go over the anesthesia method that you've chosen, and they'll review that with you. Once the procedure's over, which takes about 1 hour of actual operating time, you'll be in the recovery room. If you have the spinal anesthetic, which most people do, you will not have any pain when you wake up. You will be numb from the waist down for 4 or 5 hours, and then it will gradually, your feeling will come back and you will have pain. We will give you strong pain medicine, but there's nothing we can give you that's going to get rid of all of your pain. So I want you to keep that in mind. The first day after surgery is usually the worst for most people, but by the second day, most people are very happy and doing much better and ready to go home. So most people stay about 2 nights in the hospital. Occasionally someone will stay longer, and sometimes someone will actually go home 1 day after surgery. But we want you to stay at least 1 day to get your 24 hours of IV antibiotics. One of the other issues we want you to be aware of is when to call us and when to go to the emergency room. If any time after your surgery you have chest pain, if you have shortness of breath, or any systemic symptom like that, you need to call the EMS or immediately go to the emergency room. However, if your knee is just becoming more painful, if your temperature is over 100.5 or higher, or your knee just becomes stiff or red, you need to call us immediately. And you can get a hold of us at 864-295-1231. Please listen to the whole message. It will give you a cell phone number to call, and a live person will answer that. I want to take this time at the end of this video to again reiterate our thanks for your trust in choosing us to help you with this procedure. We want to partner with you so that you can have the best result possible.